So it's my great pleasure to introduce you Professor Hari Shankar Sharma, who is an eminent neurophysiologist and neuroscientist, and we are always very happy to have him here. We're also grateful for the support for these summer schools by Uppsala University. And Professor Sharma is going to talk about pathophysiology of the blood-brain barrier in CNS injury and repair, new roles of cerebrolysin and nanomedicine. Thanks a lot for coming.
Thank you. This is again my honor to give you some basic aspects of central nervous system injury and repair. And we are introducing nanomedicine since long time. We are working since 2003, so it's over 12 years. And as you can see that I will talk about neuropharmacology and toxicology in relation to nanomedicine. And we have support from European Office of Aerospace Research and Development, US Air Force Research Development, Swedish Strategic Research Foundation, and this is my university from where I am coming. Not working. It will work now. Well, I have to say this disclaimer that whatever I am talking to you, it's my personal view. It has nothing to do with my organizations or various government I am working with. As you can see that brain, of course, is famous for having neurons over 10 billions, but we have much more than glial cells and overall much more endothelial cells. So what we would like to do, I go here. It's not, pointer is not working. So what I would like to do is to save neurons as well as also glial cells and endothelial cells all together. But not moving on the screen, it's moving here. Okay. Yeah. And as you can see here that we have very long cooperation with Dr. Muresanu. He was in my original Indian university from where I came here. It's Banaras Hindu University in Varanasi. And my relation with blood-brain barrier is quite old. I did a PhD thesis in 1982. And what we believe that these endothelial cells are key for all kinds of neurological diseases and therapy. Here is a picture where you can see that if capillary is leaking, it will affect not only neurons but also the microenvironment of the brain. And you can see that this disturbance is common in almost all neurological diseases we know till today. The basic anatomical aspect of blood-brain barrier is tight junction, one of the aspects. And lanthanum is very small molecule, 12 angstrom, it stops here. But the cell membrane is also very important for the blood-brain barrier that protects the neuronal environment. We started our work with George Servus Navarro. He is a great neuropathologist and designated as one of the leading neuropathologists in the world from Berlin. And this is normal situation lanthanum in animal models. It stops here at the level of the microvessels. We also consider that there is also this blood-brain barrier is bipolar. Many substances cannot come to the blood from the brain, and this is important for the homeostasis. So we are working on this idea that whenever this blood-CNS barrier is broken down, it can lead to many things, having cell death. So when we talk about neuroprotection, we have to protect either here or here. Coming to the field of nanoparticles, nowadays we know that nanoparticles are everywhere. It depends on small molecules or large molecule. We breathe air, sometimes somewhere they contain microfine particles, they can produce brain damage by themselves. But on the other hand, we also have nanoparticles that can help in drug delivery. So these are two aspects. One should not be confused. Nanoparticles per se have some effect. When these nanoparticles are used to deliver drugs, then they can do much good, but also we have no idea about neurotoxicity caused by these nanoparticles. So we have this journal established and it is working. Since nanoparticles is also policymakers' point of view, so nowadays in Europe we have this nanomedicine group, and in many countries in the United States this is National Nanotechnology Initiatives. It has several billions of funds to support nanomaterials all over the world, and also in many developing countries also they have this nanoscience program. So always interaction with the politicians. This is the sitting president of India at that time. And also it has attracted attention of Nobel laureates from various disciplines like physiology and medicine. Chemistry, of course, is very close to these nanoparticles. This is Dr. Anders Shelley, who thinks that the nanomedicine is the future. This is Dr. Aaron Shikanover. He got Nobel Prize on discovery of ubiquitin and in chemistry. And we have a discussion, long discussion with him. And we believe that nanomedicine is the future. Some example to encourage you that we are going towards right direction. But why nanomedicine? Whether it enhances the drug effects than the normal compound, the questions are asked. Whether nanoparticles drug delivery can have long-lasting effects. Maybe rapid penetration into the CNS or wide areas because it has a barrier in the brain. Or it could be less degradable over time, so drug has more long-lasting effects. But what about neurotoxic effects of these particles with the drug together? These are the questions we are asking in our laboratory. The another question is whether different nanomaterials can deliver the same drug in different way. No idea. What about neuroprotection versus neurotoxicity? And I can tell you that many pharmacologists use nano delivery, but they never look the neuropathological aspect. They are only looking for what the drug is entering into the brain, how long it is staying there. So these are the points must be addressed. That is our work together with various governments in the world, including the United States. I am basically a neuropathologist. My mentor is Professor Yngve Olsson in Uppsala University Neuropathology Department. I owe all my neuropathological things and also my wife to Dr. Yngve Olsson. And of course we have interest in looking for many neuroprotective agents, novel neuroprotective agents. In this case, Dr. Skepper is also helping us in various ways. So this is the time that we cannot ignore nanomaterials in our daily lives, whether it is medicine, whether it is rehabilitation or any neurological disorders. We must consider these things. We have some group working at my university, Banaras University, and you can also see that Dr. Murasanu was there giving a nice talk, and these are some of our old colleagues. The most important aspect is use of nanomaterials or exposure in military. Not only at the Middle East region or where there are much more sand particles, but nanomaterials are emanating from Air Force planes because they are entirely built in different way. Many other ammunitions used. So people are exposed working in military environment, either peacekeeping or real soldiers. This is one example. Another example is when you have all the time attention. Of course, this is from one of the African military, but military is military. There is no difference which border you are protecting. This is the point of they are mainly on one position, having one kind of immobilization, lots of stress. So we worked with USFDA. This is Dr. Bill Slicker in his office. So we try to understand the neurotoxical aspect of these nanomaterials and also the drug delivery. These are both aspects we are pursuing together. This is another example for the military. They have the sleep deprivation. Our soldiers are mostly having 2 to 4 hours sleep. during the small space at combat, and people can really understand that they have a stress and effect of sleep deprivation. What happens to the brain? What happens to the blood-brain barrier? And they are also breathing different kinds of nanomaterials. So the first example, we studied the effect of sleep deprivation in animal model of various hours, like 12 hours of sleep deprivation, 24. We can find that there is time-related damage to the brain. 72 hours in our hands is the maximum. But when we have added some nanoparticles like copper and silver, these damages were much more exacerbated. The question is whether two different type of nanoparticles can have different effects, or the sizes. Here we can see that the small sizes, 20 to 30 nanometer of both copper and silver, have much more deleterious effects than the same nanoparticles of large size, 50 to 60 nanometer. I have very less time, I am not going in details, but I am just showing some example. One example of nano delivery of the drugs. You can see that we have given this 5-HT3 receptor antagonist ondansetron using nanowired delivery. We are able to protect it much better than the compound alone. This is an example that in certain cases, nano-delivered drugs may have more superior effects in neuroprotection. The other complication in many clinical cases that people have hypertension, and if they have brain injury or any other kinds of insult, the effects could be much more adverse. So what we did, we have used immobilization stress, partial, then hypertension, and then silica exposure. Various type of combination, because human life is not simple. And then of course we used heat stress in the model. What you can see that immobilization at normal temperature and immobilization at high ambient temperature. High ambient temperature has much more worse effect. If you add silica, then you can see it has much more worse effect. So the point is that if you have a combination of hypertension, silica nanoparticle exposure, and high heat, you have worse situation. And this can also be seen on behavioral effects. These are two different ways. Since you are students, I put this picture, and here the rats can stay here. And some of the works that we did in USFDA, they feel that we are really enhancing the effect. So this is just an appreciation. Here you can see that silica oxidation, intoxication on rotor performances. The point is, you should see here that hypertension produced by renal artery clip, immobilization, and silica at 33 has worst effect. This also happened at inclined plane angle test. The same group has the worst effect than others. So the point is that silica neurotoxicity is higher at 33 degrees Celsius. When we add with immobilization, it has much more exacerbation in neurotoxicity. This is an example of neuronal changes. I am not going in details. The point is that we have again the same situation. High ambient temperature, nanoparticles, and stress and hypertension has worse effects. This is also neuronal damage. I can show you some example here. The worst we have seen here, hypertension, silica 33, and immobilization. But you can see here neuronal injury in hypertensive and normotensive. Hypertensive animals after heat stress has much more damage. The question is, again, I asked what different kinds of drugs, whether drugs or any neuroprotective agents. Here we have used TNF alpha antibodies, tumor necrosis factor alpha antibodies. Not going in detail because in some cases TNF alpha has both protective effect and damaging effect. We have seen that 30 minutes after the insult, TNF alpha is blocked, has better effect. But if blocked before the injury, it has adverse effect. So here is an example. Nanowired TNF alpha antibodies, they are protecting neurons. What could be the basic region? We have studied nitric oxide synthase, and you can see that in hypertension, it is much more aggravated than normal conditions. When we have given TiO2, means titanium nanowire TNF alpha, much more better protection here. Another example, very common disease is diabetes, and we have studied together with heat stress. And you can see only that when we have exposed to silica and diabetes, the situation is much more worse here. And this is also at electron microscopy. I have less time. I will show you something size and age dependent. These are very important here. So the question is whether age is also a factor apart from size. The answer is yes, and I can show you some example. We have different size range of nanoparticles, different age, and then effects. The point you note here that both young and older groups are highly sensitive to these nanoparticle exposure as compared to the relatively adult group. And there is a size effect, smaller has the most effect here as compared to the larger sizes of the same nanoparticles. These things are also here with different nanoparticles. We can see that copper and silver are the most dangerous as compared to the aluminium. And also it has the same effect of blood-brain barrier breakdown. Edema formation is also same, and neuronal injury and loss is same. I can show you some examples. There was a tight correlation with the size and the damage here. So the neurotoxicity is inversely proportional to the size, and very young and elderly groups are more vulnerable. Silver and copper have more toxic effects. How much time I have? 10 minutes, 5 minutes, or it's over?
No, go ahead. 10 minutes.
10 minutes, okay. Then we look at light and electron microscopy here, and the effects were very similar. Copper and silver, small sizes produces much more damage. We went to electron microscopy, and we can also see the same effects are here, myelin damage. So the neurotoxicity is size related, and inherent properties of nanomaterials are very important. Otherwise, aluminium of the same size may have done the same effect, but it is not like that. Concerning some cases of a spinal cord injury, that is very common in war, and I can show you, we have some models of traumatic brain injury, and this is concussive head injury, this side. We came across to cerebrolysin because you know that in traumatic injury or any kind of insults, not one factor is involved. So we found that cerebrolysin is a very good drug because it has different kinds of neurotrophic factors and also many active peptide fragments. So this is a multimodal drug, so why not try in different ways and also label with nanomaterials. We have some papers regarding brain injury and cerebrolysin. We find that it's a very good drug. So as I told you that this is Dr. Ryan Tian. He is expert and he has a US patent of nanowiring production. We are working with titanium nanowire, copper nanowire and silver nanowire. Due to technical limitation, I will show only titanium nanowire results here. Although the nanowires for electronics was developed by Dr. Yan in USA too. And there are certain results showing that even stem cells, if grown on nanowires, they live longer and produce much healthier and better effect. This is an example that they are grown on silica nanowire here, and they are much more longer surviving. And this is the titanium nanowire produced by Dr. Ryan Tian. And we presented some data in National Innovation in the United States in 2013 together with Dr. Murasanu. We got this top 20% technological award. This is very prestigious. And also some discussion on spotlights that what we are doing with cerebrolysin and especially to nanowire delivery. Then these are some examples of brain injury. You can see that 24-hour and 12-hour. We have maximum damage on the other side, left side, if the injury is done on right side. And what you can see here, that if cerebrolysin was given either before or 4 hours after here, it has much more better neuroprotection than the normal drug given. And these are just an example that there is a dose-related effect, and titanium nanowire delivery of cerebrolysin has much more better effect than the cerebrolysin alone. This is an example, the same, this is GFAP, because I told you that glial cell also be protected. And this is an electron microscopic data. Cerebrolysin by itself do not cause any injury. But when we have given cerebrolysin nanowired, you can see that these neuropil is much more better protected than this one. So here we can see that dose-related effects are clearly evident, and nanowired delivery is much more better. So what we have shown here, that external temperature, cold or hot, can affect the disease processes, hypertension and many other things. I'm not going to drug effect because they also modulate brain injury. And coming to clinical cases, I can briefly show you some of results in Alzheimer, because this is the brain of Alzheimer patient. And here you can see that senile plaques are developed. We have done very simple example. We measured amyloid beta protein and in the cortex, and here is the in mice. You can see here the highly elevated, and when we have given cerebrolysin alone, it was reduced. But when we have given nanowired cerebrolysin, it is much more reduced, very similar to the animal normal condition. But these were the results for only 8 weeks of survival. The same thing happened with tau protein. It is increased in Alzheimer's disease, and we have the model that we can show increase. But nanowired cerebrolysin delivery is much more better than cerebrolysin alone. And this is Dr. Shelley. He is now thinking to do some his model nanowiring like CRF factors in our model to see together with cerebrolysin whether we can enhance the effect of these drugs. We are still working on that project. And as I told you, we have Dr. Skepper is here. We have done a special volume, nanoneuroprotection, nanoneurotoxicity, and many leading scientists feel that this is the area we should do. And since we have lots of money involved, National Nanotechnology Initiative is a US government program, and many sitting or former governors are supporting this. I will show you briefly a spinal cord injury, and you can see here in animal model, this is swelling the spinal cord and edema and cell loss. And here is the sitting governor, Michael Beebe, is supporting our National Nanotechnology Initiatives. We have different drugs, 3 kind of drugs labeled with nanoparticles, but we can see the only good drug can have protection, not all the drugs. Some drugs can be in between. So the taking home message is that if your drug is good, you can enhance its effect, but if really a bad drug, nanoparticles cannot do much. This is an example of damage, and when we have given nanowired AP713, it has much better neuroprotective effects. And obviously, when Göran Persson was the Prime Minister of Sweden for 10 years, he also supported our nanotechnology program in Sweden. Now we are doing a new experiment, and I will only disclose a part of it. We are using titanate nanospheres, and this is done in the laboratory of Ryan Tian. RCI is working on that. This is silica nanoparticles, and these are the titanate nanospheres produced. Cerebrolysin is labeled here inside. And I just want to show you, this is time release of cerebrolysin. It is gradually, when you give, the cerebrolysin is released. I'm showing only 180 minute. We have all data, but I cannot show at this moment. This is a gradual release of cerebrolysin over the period, and it has longest neuroprotective effects up to 7 weeks. The question is, final question is, if we label drug in different ways, do we have same effect or different effects? I showed you titanate nanospheres. Now we have another way of loading cerebrolysin, and this is PLGA loaded cerebrolysin. You can see here that there is a drug release up to 1400 minutes constantly, and in the blood level the drug is still valid, not destroyed. And here is the another example. You can see that even 150 days the drug is actually active in the blood. So if PLGA level nanoparticle is put inside the system, it is not destroyed and it is doing effect. This paper is just published in Molecular Neuropharmacology. We met Dr. Harry Kroto. He got Nobel Prize on nanomaterials in, of course, 1996. And he is a regular visitor of US-sponsored nanotech every year. So he also thinks, we have a very nice discussion, and now Chinese government has also tried to do some Chinese drugs, nano-labeled, and we are working together with Ministry of Science and Technology, Government of China. He is Dr. Feng, he is the Vice Director of Chinese Army, and he has lots of interest to work on these things. And my son did some experiments, this is my son, and we have Society for Neuroscience presentation. I am surprised, few days ago, I never searched literature, but I'm surprised that we published a paper in Dr. Skepper's journal, and I found that his most cited articles on cerebrolysin and also one of our articles. So this was really a surprise that nanoparticles is also highly cited in journals. And this is our military people, we are working with them. I stop here, and these are our collaborators. And I look forward to hearing from you if you have any questions or comments, because I feel that the nanomedicine has the future in both your medical practice and research. Thank you very much.
Okay, thank you very much, Hari. Are there burning questions? We're a little bit running out of time, but not too much. But so we have time for one or two burning questions. If this is not the case, of course, Professor Sharma will be around for a while, and you can ask questions later. Any burning questions for the time being? No. If this is not the case, we go on. And our next speaker will be Professor Stephen Schaefer from the University of Padua in Italy, and he is going to talk about low-grade, non-resolving neuroinflammation. Age does matter.